Hello, everyone, and welcome to Healthy Talk, empowering your wellness one conversation at a time. I'm your host, Rachel Mann, and we're back for 2026. Today, we're talking about speech therapy, and this is one of those areas where people don't always realize just how much it covers. I'm joined today by Leslie Tourte, a speech therapist here at Boone County Hospital. Leslie, thanks for being here today.
Thanks for having me, Rachel.
So for anyone listening who might not be familiar with speech therapy, could you tell us a little bit about what you do here at Boone County Hospital?
So speech therapy works with adults and children. Speech therapists work on many different areas, not just speech. We work on speech, cognition, swallowing, language, and social communication. For kiddos, we're working mostly on speech sounds, expressive, receptive language, and social communication skills. With adults, we're working on expressive language, receptive language, swallowing, cognition, and voice.
So kind of things that affect our everyday life that you don't think that might be a problem for people.
Yeah, absolutely. I think when people hear speech therapy, they think speech sounds only, but there's so much more that we do.
How did you end up in the field of speech therapy? Was it something you knew you always wanted to do?
I have a little bit of a personal connection to speech therapy. My mom was actually in speech therapy as an adult when I was in high school. So fast forward 4 years later, when I was visiting the college I was going to attend, I had to pick two different tracks to go and attend sessions about different majors. I thought I was going to go into teaching, so that was the first one that I picked. And then the second one, I just kind of picked on a whim. I knew what speech therapy was, but I thought, oh, let's just pick this. That actually ended up being the first session that we had to go to. My dad went with me. And once we left that session, we both looked at each other and said, this is it. Like, this is what you need to do. This was meant for you. And so I changed my major. And that day I entered speech therapy.
That's so cool. And it sounds like, especially dealing with kids, you said you kind of get that teaching aspect in it too, if that was another thing you were interested in.
Yeah, definitely. I liked the idea that you could work with kids or adults and in many different settings with speech therapy.
Do you see more kids or do you see more adults, or is it pretty even?
I see an even mix of kids and adults. In outpatient, it's an even mix of kids and adult, but inpatient now is obviously just adult. When people are referred to speech therapy, usually their first thing is, my speech is fine.
Sure.
I talk fine. But when they get to come into my office, or if I've seen them as an inpatient, they realize that there's a lot more that we do. Adults who are being seen for speech therapy are usually post some sort of stroke or neurological event, or it's a new diagnosis for them, like a Parkinson's or an ALS. I'm part of the rehab process of getting back to their function prior to whatever accident they had, or if it's a degenerative disease, helping them along that process and helping them to slow the progression of any speech, language, or swallowing impairments that they might have. Usually with kids, we're seeing them as more of a developmental issue, something that either the parents have noticed or the pediatrician has picked up on, and they've recommended speech therapy, or the parents have asked for the referral to speech therapy.
What would you say is something that people are usually most surprised to learn about speech therapy?
I think the number one thing people are most surprised about is that we also evaluate and treat swallowing. Most people have no connection and don't understand why speech therapy would be working on swallowing, but we're really the experts in the way that the mouth and the throat work. So that's why we treat swallowing. When I walk into an inpatient's room and say, hi, I'm Leslie, I'm from speech therapy. I'm here to check on your swallowing. They look at me a little bit strangely, but once we get into it, they understand why we're doing it. I see a lot of different patients for swallowing problems for many different reasons. Swallowing safety is important because if people are not properly able to swallow, they may be at risk of aspiration, which is when the food or the liquid gets into their airway, and further down from that, it can travel into their lungs. So this is a really critical area that we work on with people for their safety and their health. The risk of aspiration is developing something like pneumonia, which could be really detrimental to our patient's health. So it's important that we work with them on consuming the proper diet, but also using the right techniques for swallowing, and then putting them on some sort of swallow exercise program or rehab program so that they can improve their swallowing and resume consumption of their favorite foods and their favorite drinks.
When it comes to kids specifically, what are some signs parents might notice if their child could benefit from speech therapy?
Children should start using their first words around 1 year of age. Once a child is 18 months, they should have around 10 words. They should be able to follow simple directions. When a child is 2 years, they should be putting words together in short phrases or short sentences like mommy go or doggy run. By the age of 3, we expect kids to be talking in mostly sentence level. And then by age 4, we hope that they have mostly adult-like speech with some speech sound errors, obviously, and maybe some grammatical things, but mostly adult-like speech and able to carry on a conversation. So if at any time a parent thinks that their child is behind their age level peers, they should talk to their pediatrician and ask for a referral to speech therapy. I think being in speech therapy can really help ease a lot of their concern because we can point out to them what is typical in their child and what might be atypical, but how we're going to fix it. What's the plan going forward? How can we help support you? How can we help this child to catch up to their age level peers? Or how can we help maximize their potential, whatever that might be? And I think it's really beneficial to come in because we point out, but look at all the things that they can do, you know? And then the parents say, oh, wow, yes, they're doing this and they're doing this, and that's age appropriate. And that might be a little bit behind, but this is how we're going to help support the child.
Is there a point where you'd encourage parents to seek an evaluation rather than just waiting to see if it gets better?
Yes. So whenever there's a concern over a child's speech or language development, it should be brought up to the pediatrician and a referral should be made. We can really make the assessment and tell the parent whether or not it's something to be concerned about. Yeah, absolutely. And I think the wait and see approach puts a lot of our children at a disservice because we know that early intervention is so critical. We know the sooner that we get to these kiddos with speech or language delays or impairments, that the more likely that they are to catch up and that they'll catch up quicker.
So when kids come to therapy with you, how do you keep sessions fun while still helping them make progress?
Every treatment session is individualized to what the child enjoys. So if a child likes trains, we're going to play with the trains. If a child likes blocks, we're going to build with the blocks. We can take pretty much any toy and make it a language-based activity. So we go off of what the child wants. I am a child-led play-based therapist. So we're going to do what the child enjoys, keep it engaging, keep it fun, so that they want to keep coming and that they want to return.
On the adult side, how does speech therapy help people recovering from things like a stroke or a neurological event?
Speech therapy can help people who have had a stroke or a traumatic brain injury in several different areas. We work on motor speech, so the way that the speech sounds. We work on voicing. We can work on expressive communication, getting their words to come out. We can work on receptive communication, being able to comprehend what others are saying or what they're reading. We can help work on writing skills. We help also with social communication for people who have had a stroke and brain injury. And then, of course, we work on swallowing so that they're able to eat and drink the foods that they love.
What's your typical length of seeing a patient?
Completely depends on the individual. Okay. So it depends on the severity of their stroke or their traumatic brain injury, or if they're a progressive disease, they might be somebody who's going to be on my caseload for a long time with breaks in between. Okay. We might see somebody, for example, with Parkinson's. I'm certified in LSVT, which is the loud program. So this helps people with Parkinson's to project their voice. People with Parkinson's often have a low volume when they're speaking. And this program has a lot of research based, and it's for a Parkinson's patient. So that patient will come to the clinic 4 days a week for hour sessions for 4 weeks. Once those 4 weeks are done, we can discharge and then follow up in 6 months or a year, 2 years, whatever it may be, once they start to feel their symptoms come back, and they can come back and redo the program.
If they have multiple things within speech that they need to work on, do you, in a session, work on all of those things, or do you focus one session on this, one session on this?
Great question. It really is up to the patient.
Okay.
depending on what level they can handle. I try to do every area, every session so that we are maximizing their rehab benefit. But some patients can only handle, maybe the first couple sessions are just focused on language, and then we bring in the swallowing or vice versa.
Are your sessions length an hour always? Or if someone can't handle an hour, can you do them shorter?
Yes, depending on the patient's needs. I usually see people for 30 minutes, 45 minutes, or 60 minutes. Also depends on how frequently they can come into the clinic. If they could come twice a week, they might have shorter sessions. If they can only make it once a week, it may be a longer session.
How long do you normally meet with a child?
Children's sessions are typically around 45 minutes. Okay. Again, depends on their attention span and how well they can.
Makes a big difference. Yeah.
That might even change week to week just based on, sickness.
They're not having a good week this week. Yeah.
Totally. Yeah. Yeah.
What does it mean for patients to be able to receive this kind of care right here at Boone County Hospital?
This is so important as a therapy department because the people who are coming to therapy aren't coming one time. They're coming maybe twice a week, some 3 days a week, some once a week. But it's important that we're here local for them so that cuts on their commute time and their time away from doing things that they want to do outside of therapy. So it's important that we're here for them and that we can support those weekly needs of our patients.
However helpful therapy is, it's probably not the top thing on people's list to do for the day.
Yes.
Not having to drive an hour to Des Moines just to go to an hour-long appointment. I mean, that takes 3 hours out of your day right there.
Yes. Yeah. People are more likely to commit to therapy when it's local, 100%. When they don't have to make that driving commitment. So that helps us to improve their function a lot quicker. They're going to make a lot more progress when they're here local and they can just come in for their session and then go on and do the rest of their day.
Would you be able to share a moment from your work without sharing details that reminds you why this work matters, why this is important to you?
My favorite thing about speech therapy is when a patient or a spouse, a caregiver, or a parent comes in and says, they just said a new word. They just said a new phrase. They're using a new sentence, especially those things like mama and people's names. And I love you. That is my favorite part of speech therapy, is seeing them progress and coming in and telling me how their communication has improved. Communication is so important to everything that we do. It's a critical part of our quality of life and our connection with others. So me to be able to play a small piece in that for people is just incredible. That's my favorite part of my job. I think we all remember when our kids first said mama or I love you. And so being able to be a part of that is really special. I have had patients come in and say, we went to a family event over the weekend and wow, they were able to do this and they were able to say that and they asked questions. They were a part of the conversation. And that is just so special. Yeah, it's really wonderful.
It warms your heart.
Yeah.
If someone's listening and thinks they or a loved one, child, spouse, parent might benefit from speech therapy, what's the best next step?
The best thing to do is to go visit with your provider and ask for a referral to speech therapy, and then we can see them here at the clinic.
Awesome. Thank you, Leslie, so much for your time today and sharing your expertise. It was very informative. I bet it's a topic not a ton of people, unless they work with you or a speech therapist, know a lot about.
Yeah, I hope this reaches some people who have been considering speech therapy or maybe weren't, but now are, and we can help them right here locally in Boone.
If you want to find more information about our speech therapy, you can go online to www.boonehospital.com. Or if you need a referral, talk to your family practice physician and they'll get you referred here to Leslie. Until next time, stay informed, stay healthy, and keep the conversation going with Healthy Talk.